One of the first things I do when I see a client walk into my office is I try to determine how free the shoulder girdle is. I visualize the scapula and the clavicle and the humerus almost like a shoulder pads that the football players would be using. That they should be able to slide around the ribs, move forward, move back, and have a lot of freedom. And yet they're bound down on every side by muscles that are important to get the specific movements when you adduct, abduct, circumduct, and do everything with your arms. So what I really try to do is just visualize that I'm going to be doing everything in my power to make this scapula slide and glide and be free. So let's take a look a little bit at the scapula. It's just sitting right here in a neutral position, and I can get underneath it and raise it up like this. You can sort of see the shape. So here are some of the movements that you're going to want to be doing. You're going to want to be able to rotate it this way and that so that the arm can move above the head. Anytime the arm is abducted above shoulder level, the scapula actually has to be doing all the movement. The humerus is not going to move in the glenoid fossa after shoulder level. You want to be able to move it toward the head, toward the feet. It just should be very free. Dina's moves a lot easier toward the head than it does toward her feet. There's a little bit of some buildup on the upper traps and levator scapula and some of these above muscles, and I want to try to free this scapula to sort of slide down a little bit. So let's just talk about the rotator cuff muscles a little bit.
The acronym SITS is a convenient way to remember the rotator cuff muscles. Strictly speaking, the supraspinatus, infraspinatus, teres minor, and subscapularis make up the rotator cuff. However, along with some muscles of lesser importance, the deltoid, biceps, teres major, pectoralis major, and latissimus dorsi all exert force upon the shoulder joint and must be addressed to create balance in the shoulder.
The rotator cuff muscles. The crisscrossing complexity of the rotator cuff muscles demonstrates the importance of specific strokes to soften individual muscles rather than just broad superficial strokes. They, of course, are very, very important for all sorts of arm function. They decelerate the arm for pitchers or things in sports like this, and they are external rotators of the arm, and so they have a tendency to get very, very tight. Even people that are using a mouse on their right side and constantly pulling that arm back will have really tight rotator cuff here. So one of the ways that I like to work on this is rather than having the arm down in a neutral position, I may begin by doing some nice easy strokes to warm it up and feel which muscles I need to work on. But rather than doing most of my work in this position, I'm going to just move the elbow up, which actually rotates the arm into an internal rotation. So that's going to stretch the external rotators of the arm, and they're going to be in more of a stretch. So I can work on the teres minor in a stretched position this way. All of the other muscles. I can also work on the posterior deltoid. This is a great position to lengthen and open this area here. So again, there's no real fancy things you need to do. Is just do your work. Slow down, feel where you're feeling tension. Constantly move this scapula. See if you can stretch it. In this position, I've actually moved the scapula up enough that I could be working on serratus posterior here. And it is fairly tight back here. My fingers start getting tired, I'm going to use knuckles. I'm constantly thinking movement here. Elbow is even a very good tool in this area. Then I can start thinking about some of the specific scapular muscles, bring this down just a little bit, and I can work on infraspinatus, right below the spine, and just feel where it feels ropey, where it feels tight. Sink through that external tissue and just move right on that and sink and wait for the melt. You can roll the tissue a little bit, roll that infraspinatus muscle.
When you feel it's relaxed a bit, move the arm up, which will put more of a stretch on it.
Bring it down a little bit, and then you come above the spine and work on supraspinatus. It's also a very good way to just grab the scapula right along the lateral border, take your thumbs and go right underneath it, and I just visualize that I'm peeling it right off this lateral border here. I can get my hands right under here very, very well to get into subscapularis, and I've actually just got my thumbs hooked right on the front side of this scapula, and I'm both stretching subscapularis by peeling this scapula off and just visualize like I'm prying it off the rib cage here. And then I can just soften things a little bit, and with my thumbs or holding it up here, I can actually use my fingers and I can actually work on subscapularis. So I'm quite deep here now. I'm right on her posterior ribs here. I just work my way all along the border. Any place you feel some sort of tension, fibrousness, just wait and wait for that to soften. There's nothing fancy about this. It's just go for where the tension is and try to soften it. So I would start with some broad work. I'd move to the specific work, and then I would be moving to more broad work again to integrate. I do want to show you one other, I think, very effective way of working on the rotator cuff that you can add to the internal rotation that we've been talking about. And that is that you would take the lower part of your client's arm and slide your left hand underneath it, and then just grab the humerus or the upper arm here. And this gives you all sorts of possibilities for movement here. I can distract the shoulder by pulling it out. I can actually compress it. And sometimes compressing a shoulder is all that you need to let those muscles relax. And at the same time, while I'm doing that, I can rotate the humerus. So I can get on any muscles that I want and anchor them. Here I'm going to distract and roll into internal rotation. So I'm accentuating the stretch here on supraspinatus and all of the tissue here. Actually, the posterior deltoid is very accessible from here. And of course, I can move this any way I want to all the way above her head by just distracting, rotating, and then the arms up this way, and I can work on the medial border this way, as we've talked about for working on the rhomboids. We've already discussed working on levator, scapula, and trapezius, but just to show a little different angle here, of course I can do the same thing again. So I'm not just stretching trapezius, I'm visualizing taking this scapula and moving it this way, holding it there, and letting it fall and relax. Let's move over to the other side to get a little view of subscapularis again from the medial border of the scapula. A lot of times in early classes, People are told to put the arm up back like this to raise this. I don't particularly prefer this. Number one, this is a bit of a threatening position for people and may elicit some memories of abuse from childhood. And I don't think you have nearly the flexibility that you do if you just take the arm and let it nice and relaxed lie to the side. Get your other hand in a nice soft palm and just lift straight to the ceiling, which will raise this scapula up and let you get under it. So I'm up to almost my middle knuckle here. And while I'm here, I don't want to just see how far I can get. I want to move this scapula through different ranges. Close, pull it back, find out where can I increase some mobility here. Sometimes it's a little harder to get access the farther up you get in the scapula. So what I usually do is start in the most accessible point and then move up. This is the most accessible way to work on the scapula in the prone position, but let's explore a couple other possibilities that will give you even more latitude in your goals and your techniques. The side-lying position also affords another wonderful way of freeing up the scapula, particularly along the lateral border. So if we look at Dina in the neutral position with her arm down here, I'm going to notice when I bring her arm up, where do I feel strain patterns? I'm not just going to have her raise it up. I want to feel, is it a deep joint issue that may be affecting this shoulder? Is it a superficial fascia or a particular muscle? So I'm going to take her arm up and just sort of notice how it wants to go. And first thing I notice is that hers wants to go into internal rotation here. So what I want to work on is I want to be able to lengthen those muscles that are associated with internal rotation so that she can actually rotate her shoulder externally a little more easily. And the first thing I might do is just move it in different ranges here and feel, where do I feel the first strain? And actually the first I feel is down around the serratus anterior area. So I'm just going to do some nice broad work here to open that up. What you do is you just keep moving up the chain. You free one area. This is a great way to work, and your clients will really notice the difference then. And they'll say, oh wow, well, now I feel it somewhere else. So now I'm going to move her up, and that is easier. Her lower scapula is freeing, moving a little more easily, and I feel I want to move up in here to the middle of her medial border here. And this is a great position to just sort of get your body right next to your clients so that they're not going to roll over. They're going to be leaning against your hip. And all I do is I take my hand and start peeling this scapula back. I think most of Dina's internal rotation is caused by her scapula being rolled forward this way rather than by individual muscles. So I'm just going to pull this out, get her into a much more externally rotated position. Sink in with a fairly sharp elbow. I'm not pushing very hard, but the elbow affords me a fairly sharp surface to sort of sink in and peel this scapula back. You work slowly here. As long as you keep to the outside here and don't go too far up the axilla, you're not going to have to worry about lymph nodes. And now I feel actually probably teres major and teres minor because they're both put on a stretch as the arm is above her head. And I want to be a little more specific now. So now I'm going to switch from my elbow to fingers. Try to work with those teres muscles. Remember that teres major is an internal rotator of the humerus. So I'm going to really be trying to direct my attention to teres major so that I can externally rotate this humerus. My fingers get tired and I want to use another tool, then I can switch to knuckles. Test your progress. I actually feel like the lower part of her scapula down here is a factor now in the posterior section, so I'm going to work a little bit along there. And then I can really feel some tension in the triceps area. So I'm just going to use my thumbs. I'm not going to be working too deeply. I'm going to go back to our early techniques that we showed in the fundamentals. I want this triceps to be able to revolve around the humerus without the humerus going with it. It's a little stuck down here. So I'm going to try to keep the humerus in a neutral position and just roll this triceps. Lift it off the bone here. And give her some more freedom here. If I want to move to a lengthening stroke with the triceps, then I can come like this. Okay, so let her give her arm to me and relax. And now I can pull her arm up without it having to go this way. So it's able to externally rotate. There's one last little area back here that I'm going to put on a little bit more of a stretch, even though I've already worked there, because I feel this is the last restraint here. I'm very lucky in my work, since I work with dancers and athletes, that very often we'll stop something. They'll be wearing their underclothes, and we can take a break and have them stand up and move around, raise their arms, and feel the difference, which lets them evaluate the benefits of the work. This is where you need to start thinking about your practice, that you can start doing spot work. You may want to spend a whole hour on somebody's shoulder girdle, so they'll walk out of there feeling very, very different. One other quick position I'm just going to run through without doing a lot of work is that in the side lying, you can also work on internal and external rotation by just taking your hand here and using it as a lever. So if I wanted to externally rotate, I just move her arm this way and abduct it. If I wanted to internally rotate, I could just move it the other direction and move it up. Let's talk about the upper part of the shoulder girdle next. I realize that I've been showing you an awful lot of strokes in the side lying position, and for some of you, you may not have ever worked on this except in an occasional pregnant client or something like that. So I want to talk just a little bit about the importance of doing this work. I have several students of mine that just felt it totally transformed their practice. They became much more professional, much more goal-oriented in opening up areas and doing more specific work instead of what some of them used to call the cookie cutter massage. And your clients will love it. The one thing that I will mention that is probably not too fair to you is that I've got a model that's wearing a bathing suit, so I don't have to worry about the draping. And I will just say it's worth your effort to figure out how to drape, whether you need a couple extra towels, a couple extra pillows or bolsters or something like that, that this is very, very effective work. So please do try it. Students often leave the class very, very excited over how much results they've had in the class, and then come back after a week and say, you know, they didn't do it in their private practice because they weren't sure how to do the draping. So do work through that. Explain to your clients that the draping may be a little awkward, and sometimes it even helps to have a person put on their underclothes to enable you to work on them this way. But if you're doing any kind of structural and fix-it type work, the side lying is extremely useful. Let me just show you a couple other little techniques that you might find interesting and useful in the side lying, and then we'll move to more conventional postures. The first I want to talk about is the upper scapular area. The upper trapezius, we've got levator scapula, the splenius muscles, and then of course all of these deep muscles here. So this position affords you so much possibility. You can work with rotation of the cervicals. You can bring the arm down to really stretch this area, and that's the way I'm going to work. Going back to a couple of the basic strokes from the fundamentals tape, all I need to do is pull this arm down, and then I can do a stretch and separate stroke. So I can anchor here and then stretch away, but I can continue this all the way up to the mastoid process. If you want to augment the stretch by moving farther down here, then you can come up to this side, and as you're pushing down, lengthen in the direction of stretch. Dina's a little more right up around the clavicle here is where I feel most of her tension, so I would be doing some very detailed work. I'd just be waiting for this to soften. And then move it down the posterior area toward the rhomboids. I wanted to get a little more movement of the scapula. I could always just have her arm hang over and then pull this scapula this way and work along the border this way. Or I could anchor my hand here and bring her scapula back and be working on subscapularis and freeing it this way. This is also an excellent stretch to work on the pec major. The pectoralis major muscle. This drawing demonstrates how, in addition to abducting the arm, bringing the arm behind the midline in side-lying position can effect an even greater release of the muscle. All I need to do is just anchor the pec major here. The farther back I bring her arm, the more I'm stretching it, of course. Notice that I'm externally rotating the humerus to stretch the pectoralis major. And as I abduct the arm, again, I'm stretching at different fibers and moving up this way. And this is a great area to get right below the clavicle and work on subclavius. You really can't get a stretch on the pec major any other way when a person is lying on their back in the supine position. So now I'm stretching the upper fibers as I bring her arm down. So that's pretty much it for the side lying position. We'll give you a break from that for a while. The upper chest is very, very important, both for postural, structural, and even for emotional reasons. So it is an area that you can certainly add a large, large dimension to your practice by expanding your work to really have an understanding about the way the sternum, the ribs, the clavicle, and the individual muscles work here, rather than just doing a little bit of kneading to the upper pec major. So let's explore a little bit about the upper shoulder girdle in the supine position and talk about some ways of working with it that way. Again, just a little bit of oil or lotion. I prefer lotion to oil. It soaks in, and you can always add more. If you've got a little bit too much oil on, you're out of luck unless you rub it down. So I don't just limit myself to the chest anyway. I'm going to start tying in the arms right now anyway, even though I'm going to be working on them later. So I'll do those requisite kneading strokes. They feel wonderful. I certainly am not denigrating those, but the upper chest affords so many more possibilities for work. You'll see an awful lot of the people that come in for Rolfing with structural work feel that they're lifted up and in so that their shoulders are pulled in like this. And then they spend a lot of time with their posterior muscles trying to pull those arms back and open up the chest, where what they really need is just opening up the chest so those rhomboids and posterior muscles can relax. So after I've warmed up the outer muscles in a neutral position, I then sort of shift my attention to the sternum, to the clavicle, and what's going on here? Are the clavicles pulled too close together? Are one higher than the other? How do they move? Can I get some mobility of these clavicles here? So I'm going to probably accentuate. The clavicles really are fairly immobile in their movement, but I'm going to sort of accentuate what I'm trying to do here to make it easier for you to see. Don't expect to see this much movement when you're working. What I try to do is I actually try to go right through all of that tissue, grab the clavicle, check for movement. How does it move up and down? And particularly, can it rotate like this? So I grab it and I just very slowly rotate it, just like I've got a pencil that I'm turning. It'll reach the end. I'm going to wait there a little bit to see if it goes a little bit farther. And then I'll try to get my hands underneath it and rotate it back the other way. If you feel some muscular holding patterns, then you can move a little bit quicker here to try to override those patterns. Right at the inferior border of the clavicle, right about here, is where the coracoid process is. And this is a very, very important area to work on. I usually do it 2 or 3 times during the chest work rather than trying to do it all at once. The pec minor attaches right here. The pectoralis minor muscle. The pectoralis minor muscle, which attaches to the 3rd through the 5th ribs and the coracoid process, is extremely important to release the shoulders that are being pulled forward. It is necessary to learn how to work through the pectoralis major to access this muscle. So it can be very, very fibrous, and if the pec minor is short, it just pulls that scapula forward as it attaches there, and you really need to get some length here. The pec minor goes underneath the pec major, which is running at an angle like this, and the pec minor goes here. It attaches through the 3rd through the 5th ribs. So I'm now going to move down here and really change my focus and just start working on this pec minor. I'm going to keep trying to peel the scapula back, get some length. And this can be very, very tender here as well. So you move very slowly. I'm going to use my thumbs just so you can sort of see this area and my hand won't be in the way. Sometimes you just get right on that tendinous insertion and just wait and ask for breath. Take a nice deep breath. You know, that's good. And relax. If you want to feel the pec minor to get an idea where it is, sometimes all I ask is that Dina, as I'm anchoring in here, move her elbow straight out, and you'll feel that pec minor stretch and back down. And that'll tell you where its location is. Right along the inferior border, I mentioned it earlier, subclavius. It can be very, very tight. Dina's actually feels quite good. When you do detailed, specific work like this, your people are going to stand up and they're going to be breathing very, very differently. So I could certainly spend a lot more time on pec minor and on all these muscles. What you want to do is you don't try to do it overnight and just do it in one session. Once you start doing some lighter work and the people will feel what this feels like and how it benefits them, then they're going to probably ask you for some more work. In my Rolfing practice, people all the time say, can we do some more chest work? So you can move from your hands to be using some of the other tools we've talked about. Now I've got a nice soft fist. You can see my hands nice and soft. And I'm just going to start moving with pec major here. And there's absolutely nothing wrong with getting a little stretch to pec major and taking your forearm in here and then moving the arm up and getting a stretch this way. This is similar to what we did in the side-lying position. I think the side-lying position works a little easier for this, but if you're limited in time and you haven't turned them on their side, this is a good way to get a stretch here. And abduct the arm. You notice that it's not easy to move it farther behind the body, which in the side lying it's very easy to do. Let's talk a little bit about the ribs now. I very often get a symmetrical hold on the side of the ribs, right around pec major. You can see I'm grabbing pec major here, but I try to sink right through there and forget about the tissue and notice how the ribs move. Dina moves much easier this way in a clockwise position. When I move her in a counterclockwise, there's a little bit of hang up at the ribs. So I'm going to not worry about the left side. I feel the hang up right about here where my thumb is. I'm going to sink through that tissue, and I may even take my other hand and put it underneath to work on those ribs in the back. And I just start playing around doing the Ouija board I've talked about. How can I move these ribs to try to get some better movement there? And this makes sense to me because if you remember when we were working on Dina in the prone position, over on her right side, these particular ribs were also immobile. So you often have to work in the front as well as the back to try to get some rib movement. Sometimes I'll just open up and just wait and see if her body will tell me this is some more unwinding, which way it wants to go. Same things that I talked about in the prone position. If you feel a particular rib that's rotated and you feel the bottom edge or you feel the top edge, then you can work to derotate that rib. This is such an important area because it's the connection or the junction between your thoracic and your cervicals. And if you start in on the neck and haven't done your homework on the upper thoracic, both in the back and in the front, then there's going to be this area here that there's no transmission of energy through. So I always try to do some work on the upper ribs in both the front and the back before I start doing any profound or deep work on the neck. I probably worked for 3 to 4 years in my Rolfing practice and in my massage practice before I even started working on the first rib. So I want to show you some things to save you having to make that error of waiting that long. The first rib is incredibly important to be working with. It's important as a junction between the cervicals and the thoracics. And very often the first rib on one side will be much less mobile than another. I've got the camera positioned so that you can see the left side here. Actually, Dina's right first rib is much less mobile than the left. But I'm going to be demonstrating this on a very mobile element here for her, just so you can see a little bit better. The key to working with the first rib is to use a nice, soft, fleshy part of your thumb. You're not going to be pokey in the way you do this. And all you need to do is find the front border of the upper trapezius, let your hand come right in next to the neck, right over that border, and you'll be on the first rib. And you can feel this. This is actually quite easy. So be sure to palpate this with a friend, and you'll find that a lot of that neck work that hasn't been taking hold for you, if you start working with the first rib, it'll start working. Anytime you have to side bend the head to the left, the left first rib must be able to get out of the way, or else you're going to be log jamming right in here. So the first thing I do is just from left to right. I alternate. I don't go both together because that's not going to be telling me too much. I go left and I go right. And then I feel which rib needs the most work. I might work 3 or 4 times as much on one side. So this, again, is not just symmetrical bilateral work. Once you get on that rib and you feel that you've got it as mobilized as you can by doing a little bit of rocking, going to the end range, feel where those ligaments become tight, and then sort of wait, and then rock it a little bit. So I'm moving from the inferior border of the rib to the superior border of the rib so that it is rotating like this and like this. Try to free it up that way. And then all I do is I just put my thumb right in here, right where the rib attaches to the spine. I anchor it down and then use the head as a lever and just push it. That rib, because that's the natural way that it's supposed to move, if you're helping it, that rib will start moving out of the way, and there you've mobilized it. If you haven't had success in about 30 or 45 seconds, then don't worry about it. It just may not be the time. There may be some other issues there. You don't want to, at least the first time you do this, you don't want to overwork it. And then on the other side, I'm going to have my hand in the same place, and then I'm going to move to the other side. I'm actually going to go a little slower here because this is the side that needs mobilizing. Don't be afraid of this first rib. It's very gratifying work. Just explain to your client what you're doing, and you'll find that rotation and side bending of C7 will be greatly helped if you can mobilize the first rib, and therefore you'll probably be working at mobilizing T1 as well. Do try this. Find another massage therapist partner so you're not experimenting on your clients, and work with this and get some feedback. It's very, very important work. All of this great work you've been doing to the shoulder girdle and the rotator cuff, the clavicle, the scapula, the first rib, all of this will be greatly aided if you do some work to the arms. The arms hold a lot of tension, particularly in the elbow area and in the wrist area, and an awful lot of people are skating on thin ice as far as working with computers and having strain in their arms. So it not only will help your work with the shoulder girdle, but it also will prevent some injuries that people have with overuse with the computers. So there are no special tricks to the arm. It's basically get in there, feel where the tension patterns are, and I try to just feel like the arms are just dangling and hanging right from that shoulder girdle all the way through, so that everything is lengthened and relaxed instead of compressed. So first I'm going to work on the biceps, and I'm just using a knuckle here. If I felt a person were very, very tight here, I might start with a fist. If their arm was rolled too far internally, I might roll it out. Being careful to not work on the inside of the arm here. There's some nerves that move down there. Dina's biceps feel in pretty good shape, so I'm really not going to spend too much time there. But if you had a weightlifter with very short biceps so that the arm couldn't straighten out any more than this, then you'd have to do a lot of lengthening work to try to enable this elbow to straighten out. I'd like to work on the triceps in a couple of positions. Up here is a very good one because its attachment down below will be put onto a stretch. And the more I flex the elbow, the more the lower triceps will be stretched. So here, just to keep my body out of the way, I'll do a raking stroke. I'll just stretch the arm up and try to distract or traction the humerus from the glenoid fossa above the shoulder. and just get a stretch here. And if I feel any rotational resistance, I want to rotate her in a little bit more. I'll work on her in that position. Now that it's up here, might as well do a little bit on the posterior shoulder. Just try to integrate this. I try to not just work on one area at a time. I try to give a person an understanding of how the front's connected to the back, how energy is transmitted over joints. I'm always feeling, I'm just trying to jostle this and see if there's any strain patterns. I feel like the humerus is dropping out of the glenoid fossa very well here. There's a nice relaxation. So I'm going to move on down to the elbow and then down to the wrist. I love working on the elbow. It's just so ripe. It's got so much tension, and particularly with people that have no idea how much tension is there, it's so rewarding. So I just start with some nice broad work. I'm working on the outside fascia here, checking for rotation, checking this radius, how it rotates around that ulna. See if she's got good movement there. It rotates into pronation very well. She's very, very flexible there. So I might spend a minute or two just doing nice broad strokes, trying to visualize opening up this joint. If somebody had tight biceps, this might be a nice way to shorten the biceps, anchor, and then lengthen. After I've done that work, then there are two major muscle groups that I really am thinking about in the lower arm. The top part of the arm will have the wrist extensors. When they contract, they extend the wrist. So these extensor muscles, I'm just going to first soften without worrying too much about rotation. And as I was moving up here, I felt a really hard area here that I just sort of glided right over and almost slipped off it. So I'm going to do some more work in here. And I could probably spend 2 or 3 minutes just on this spot, trying to work with that radius, how it moves around that ulna here. So here's the ulna and the radius. When it gets right down here, there's some fibrousness in here. And what I probably would do, there's also an interosseous membrane that rotates with this here. I probably would suggest coming in here with my elbow and just waiting. At the same time, I'm trying to lever this radius to rotate around that ulna. So I'm softening tissue, but I'm also levering the bone so that it can move better. One of the common injuries you encounter with the elbow is tennis elbow, which is right on the outside here. And supinator muscle comes and grabs a hold of the radius here, and when it tightens, it supinates the arm. So if this is real tight and somebody's typing or playing tennis and putting this on a stretch, then you're going to develop some tendonitis here. So what I try to do is really anchor this supinator muscle and then rotate away and just keep getting some length in here. If you felt really, really fibrous areas, then you'd go to some heavier artillery. Move up to your knuckle or your elbow. The other side of the coin is the pronator teres muscle, which when it contracts, pronates the wrist this way. So it grabs the radius on the front side here and moves this way. And it's all part of the flexor compartment of the arm. So on this, I'm going to do some nice broad work first. This always feels good. Use the fleshy part of your forearm. Little more nerve running down here and sensitive areas here, so you want to be a little careful, be a little broader here. I think the key to the difference in deep work that's structural is, rather than just squeezing tissue and softening it, is to extend this wrist. Going to anchor and extend the wrist. That's going to stretch these flexor muscles. Shorten again, anchor, and extend the wrist. I'll often go back and forth. I might want to move the arm over now and work in the extensor group again. Same thing, anchor and flex the wrist. Move it into different positions. Moving down the arm to the wrist, this is also great work. You want to work on all the different movements of the wrist. Pronation, supination, inversion, eversion, extension, flexion, and take a look at a skeleton or an anatomy book, better yet a skeleton, so you can get the idea about where these bones are, and start thinking of these carpal bones here. How do they move? Where are they not moving? And just start sinking through tissue, grabbing bones and moving them through ranges of motion till you feel that they're not working in some direction. Then you stop and see if you can talk them into moving. There was just a little bit of a glide there. A bone gave a little tiny little lurch, and I think we freed up some more of the carpal bones here. You don't need to know the specific names here. The main thing is you're not going to force anything, but you're just going to go through the range of motion and find out areas where it's not moving. I talk in the book about teaching muscles to shorten. A lot of people that are sitting at keyboards and run into trouble, it's because these muscles are not able to shorten enough here. It isn't that they're necessarily so tight in the flexor compartment. The extensors are not able to shorten, so I often move in just the opposite direction from the anchor and stretch, and that is I'm going to move the muscles into a shortened position and expedite that with my knuckle. If they're not straining to do this, it's not going to be straining the carpal tunnel here as things stretch. And then with the hands, again, I try to feel metacarpals. How are they moving? Little bit between the third and the fourth metacarpal here aren't really moving. So I'm just going to grab each bone, just try to move it through a range of motion. You can still be doing a lot of that work that feels real good, although, as I mentioned in the beginning of the first tape, using your knuckles is probably more effective than the thumbs, and you can do that forever without risking overuse injuries to your thumbs. People that are grabbing things, very often the thumb flexors are going to be very tight in here. So I can just pull the thumb out, stretch that this way. If you have the luxury and you know whom you're working with and in a nice relaxed position and you're doing some work that it is convenient to have them stand, it's really, really interesting to have somebody stand up when you've worked on one hand and one arm and notice the difference of how the energy is flowing up through their body. It's a great lesson to them, the importance of keeping this area open. Leave time for your arm work. It will really tie together all of that great work you've been doing on the upper body. prone position is not my favorite position to work on the neck, but I want to just mention a couple suggestions, some that I think may benefit your work by doing them, and some that I might suggest you don't do when you're working on the neck in the prone position. So if you notice in the prone position, the neck is pretty much locked into a neutral position. Depending on how much you elevate the headrest, you're really not going to get much change in extension or flexion, and you can do very little rotation of the neck. So on the other side, it is important after you've done all this great back work and freed that up that you don't just stop and move down to the legs without tying this into the neck a little bit. So the only thing I would say is that there's nothing fancy to be done in the neck in this position except just be meticulous and slow. Do your nice broad strokes at first. And then just start noticing where are tight muscles. Start sinking through those outer muscles and see if you can find some of these small little muscles that connect a transverse process to the vertebra above or to the spinous process of the vertebra above, and try to do some nice, patient softening work here. The deep thoracic and cervical muscles. Although it isn't crucial to know the exact names of these muscles, it is important to realize that they are usually the muscles that are causing complaints of a stiff neck from your clients. It is important to learn how to work through those large superficial muscles to contact these smaller, intricate muscles. You can do some minimal work with rotation. You can just grab one vertebra and then the vertebra above, and you just move in separate directions. And even though you're not turning the head very much, you can be mobilizing these vertebrae. What I think is very, very important to get across is that you are not going to be pushing straight down toward the floor on any of these vertebrae. It's too easy to displace a vertebra anteriorly here. So I do work on the muscles. I'm very careful to not work on the vertebra with anterior-posterior pressure. There's no way for the head to move. You can go anterior-posterior in the supine position, and the head can move along with it, and it's a lot safer. So don't be pushing straight down with force on the vertebra. I think the best way to work on the neck in the prone position is actually to take advantage of putting a couple pillows underneath the chest so that you can get some side bending and rotation that you might not even be able to get into supine. So I've got a couple pillows here, and if we put them underneath Dina's chest and have her slide down, clear off the face rest. These will sink in. That's not quite as high as it might look. The other caveat I might mention is if somebody's got a pronounced lordosis in their spine, this can be creating quite a bit of extension in the lower spine. So if this were a problem with somebody, if they stiffened up here, then you could also put another pillow underneath their stomach here so that their spine wouldn't be in as much extension. You're only going to be working here for 4 or 5 minutes at the most anyway, so this is probably not an important issue. Now you can see how Dina's head, when she rotates to her left here, we've got a lot of curve here. We can work with side bending one way. We can work with side bending the other. We can do a lot of things with these vertebrae to free them up. I can distract the neck by pulling it this way. I can free up the articulation between vertebrae by putting my thumb on the transverse process of one vertebra and then putting my other thumb on the transverse or spinous process of the next vertebra and rotating them in opposite directions to free them up. So you can do some rather specific work here. And here I feel some soft tissue that I'm not going to think about the osseous component now or the bony component. When I feel some, with the neck on a nice stretch here, I can just feel some muscles that are spasming, so I want to soften those, and I'm just going to slow down and sink. You can use one hand as a fulcrum upon which to make all your movement, and you can just do a lot of nice mobilization here. It's a great way to work on the posterior scalenes as well. Just remember, I'm showing a lot of different strokes and possibilities, and that in a real massage I'd be working much more slowly and with continuity. So try this. I think you'll find I actually have a fair number of clients that when we put a pillow underneath their chest and move their neck into flexion, what it does is, as we've talked about these facets here, it opens up those facets a little bit as that neck moves into flexion. So it can be very, very beneficial for you. I probably wouldn't spend over 3 or 4 minutes this way, and then I frequently turn the head so that it doesn't get stiff on the other side. And then I just sort of look, how's the continuity here? How does the continuity all the way up through the thoracics, down through the cervicals? Are there any areas that I'm not seeing a smooth transition here? And if so, then I get in to try to work on that tissue and maybe even work on a vertebra to try to free it up a little bit. The supine position is my favorite position to work on the neck and the head. This is a position that most of us work on anyway, so I assume that most of you are fairly well apprised at how to work on the gross musculature, the external muscles there, and I'm going to concentrate on some of the more fine work that you can do with the vertebra and some of the specific muscles. So let's take a look at the anterior neck to begin. And I think the most important muscles in the anterior neck that I'm really going to spend the most time on would be the scalene muscles and the sternocleidomastoid muscle here. The scalene muscles. The anterior and medial scalene muscles attach to the first rib and to the anterior aspects of the transverse processes of C2 through C7. The posterior scalene muscle attaches to the second rib and to the posterior aspects of the transverse processes of C6 and C7. So the problem with a lot of people is they do a lot of thoracic breathing and they pull up their ribs with these scalenes, or they're leaning forward to look into their monitor of their computer, and they get very, very tight. So what you want to do is you want to soften these scalenes so those ribs can fall. It's particularly important for people that are going through thoracic outlet problems or computer overuse problems. So the key on this is to find the right amount of pressure to sink into these scalenes. And one of the things you can do to start them in a soft, shortened position so that you can access them is raise the head into flexion. This is very, very important, rather than just letting the head sit there. If your hands get tired, you could take a pillow and put it up here. But what I do is, this is an anchor and stretch move. I anchor and move down below the clavicle here, and then tilt the head back. And I just keep anchoring and tilting. Whenever I feel tension, I sink in, it's nice and soft, and then I stretch it back. After you've done that and the person's feeling fairly confident with that, you can also get particular fibers and start rotating the head in the opposite direction. You can work with rotation. You can work with side bending. So I'm going to keep rotation the same, and I'm going to side bend. I'm on the medial scalenes now. The other thing is to follow these scalenes up and be able to palpate the transverse processes all the way up to the atlas, so that you know where these are. The atlas is fairly easy. All you need to do is come to the mastoid process here and just go down toward the feet about 1/2 an inch and maybe 1/16 of an inch up toward the ceiling or anterior, and you should feel a little bump there, and that'll be the atlas. And as you work your way down, you should be able to feel all these transverse processes. And realize that the anterior and medial scalenes attach to the transverse processes of the 2nd through the 6th cervicals. So you're going to keep your hands very soft, but realize that's where a lot of the tendonitis problems, similar to tennis elbow or whatever, is that when people have sore neck muscles, it's very often just the tendons that are attaching to those bones because those muscles are overworked. So you soften the muscles and you soften those tendons by working right on the bones. This again is slow, meticulous work. You can do a minute or two in a regular massage, but I like to just talk with people and say, let's really get this neck moving. And you just keep your hands soft and you feel where every fiber is there. You can almost see from the film here that I'm rolling over some really tight medial scalenes here. And I'm just going to anchor on them. And then I'm going to move on. Do some rotation and side bending here now. I can turn the head over and side bend and actually get clear down into the posterior scalenes here. Although I think the prone position is probably a better way to start working on the posterior scalenes.
The sternocleidomastoid muscle. The two heads of the sternocleidomastoid attach to the sternum and to the clavicle. And in addition to softening and lengthening this muscle, it is often necessary to free it from adhesions to deeper muscles.
The other important muscle, and has a lot of trigger points that can influence headache syndromes, is the sternocleidomastoid muscle. And you should be able to differentiate it all the way down. It has two heads. It has a clavicular head that comes down to the clavicle, and it has a sternal head that comes over to the sternum. And the thing that I notice with the sternocleidomastoid is it gets short and fibrous, and it also gets bound to the muscles below. So you want to work slowly. I demonstrated this in the fundamentals tape, but I really was just trying to get the concept of lifting. I would work much slower than I did in the fundamentals tape, and I would just grab this muscle and just wait, do some small little movements, stretch it, shorten it, see how you can lift it away here. The thing that's so surprising about the sternocleidomastoid is that it really feels good to have this worked on as long as you're working slowly and have soft hands.
My clients are often surprised and they ask, "What are you doing there? That feels so good."
All I need to do is just stretch this mastoid process over here, and I'm going to be stretching that sternocleido. I can then shorten it. Remember that it shortens and pulls the head to the right. The left sternocleidomastoid, when it contracts, it actually pulls this mastoid process forward to turn this way. So if you want to shorten the sternocleidomastoid, you're not actually going to go this way. You're going to tilt the head to the opposite side. And you may feel some trigger points on there. When you do that, just ease up rather than working harder and just melt into those trigger points. Some other areas you may want to work on, definitely get an anatomy book or check in the deep tissue manual accompaniment to this. But some of the other muscles that attach at the bottom of the chin are also very important.
The digastric muscle. Although this muscle is not commonly addressed in a massage, one can see from this drawing how tightness of this muscle could cause deviation of the hyoid bone, either too far anterior, posterior, or from left to right.
Just let your hand be nice and soft and just sink in there. Line the whole jaw here. Come back to the angle of the jaw and work around that, and you can actually work on the lower insertion of the medial pterygoid here. Have the client bite down, and you'll feel that muscle tighten as it's pulling the jaw short, and then just soften, and you just wait for that to melt. Let's talk about the posterior part of the neck when you're working in a supine position. And this is a little bit hard to show in a videotape. I debated not even doing this, but I want you to get at least the concepts and hopefully take a class where you really specialize in the neck. Let's talk a little bit about the vertebral motions that you're going to experience in the neck. So the first one I want to talk about that can tell you an awful lot about the neck is side glide. I'll just get my hands right on the side of a vertebra and move it from side to side. I'm not rotating, I'm not side bending, I'm just checking for glide from side to side. And you'll find a big variation in one side or another.
So I'm just sliding an individual vertebra from side to side in relation to its inferior neighbor.
Dina moves much easier to her right than her left. There's a bit of a hang up here. And then when you feel that's not moving, then all you need to do is take your hand and use it as a fulcrum, and you can do a little bit of side bending, which you can see. I'm going to move to this side so you can get an idea. If she weren't able to glide this way, I would just use my hand as a fulcrum right beside this vertebra and side bend. Very often that's all you need to shift that vertebra and mobilize it so that you got some better balance here. The other issues are rotation. And the big thing on rotation is if you turn somebody's head this way, you may have 4 or 5 vertebrae that are doing all of the work, and there may be 2 or 3 that aren't turning at all or very, very little. So for when I try to do rotation, I try to do it 1 vertebra at a time. I'll grab the transverse processes and try to turn it on the vertebra below and see how it turns. And if it doesn't turn, then I'm going to really focus that turning right at that level. And the real key to this, I want you to really listen to this and mark this in your memory bank, is that sometimes when you can't rotate, all you need to do is move the head into flexion, and all of a sudden it'll open up that facet and you can rotate. If that doesn't work, I found like 2 out of 3 times moving into flexion helps. Sometimes you have to move into extension and do the same. But the main point is, rather than doing broad general movements of the neck, you want to be very specific and work at a vertebral level when you do this. I want to show one other little trick that I think can really help with the neck work, and that is, as I just said, to work the neck in extension. Now, in this position, we have to strain Dina's neck and really push it too far forward in making this curve. So all I'm going to have Dina do is sit up for just a moment, and you help her up, and then put a pillow right here so that her head hangs over the pillow into a little bit of extension. Now I don't have to hold her head up, and she's into a nice pattern, and I can work on her in a different position here. And Dina's neck actually moves much easier in extension than it does flexion. So you can mobilize the neck in the area that it's most easy, and then you could go back to try to work on her in flexion and see if you can move that. Anytime I feel a vertebra that's not moving, I'll just get my thumb or my fingers, whichever works for me, and I'll start playing around with side bending, rotation, flexion, extension, and see what we can to mobilize this. I've been working for over 15 years trying to perfect my neck skills, and they continue to get better and better, but there's always room for improvement. I think learning how to work with the neck is the sort of bread and butter of your practice, and it's also so fun, and your clients will love it. So don't content yourself to be doing just nice, broad, feel-good strokes on the neck. See what you can do to mobilize this neck. Muscles and fascia of the skull. Our clients often hold exceptional tension in their scalp and skull. Learning how to work deeply with these muscles to release tension can be a very effective treatment plan. The skull and the scalp are another area that can really benefit to release a lot of tension. A lot of us hold a lot of emotion in our faces. Some people are pulling their foreheads way up whenever they're excited. Other people knit their brow and bring it together like this. So don't just stop with the neck. If you look at all the muscles that follow through up here, the temporalis particularly, people that grind their jaws and bite down, the temporalis will be very, very tight. So spend some time working on the head. A lot of people have never had their head worked on outside of very light, just feel-good work. So what I do is I just imagine a cap that goes all around here, and certain areas are going to be tight, and I just use my nice soft fingers here and I grab areas. So I'm right on her temporalis area here, and I'm just going to sort of start moving this fascia and these muscles in whatever direction. And I'm doing the same thing on the other side. I'm just playing one off the other. And then when I feel that we've come to end range, I stop and I wait there and see if I can just stretch that fascia. Remember that the sphenoid bone is right about here, right near the end of the eyebrows, and a little bit posterior and a little bit toward the feet. And this is an area that you're not going to want to be doing any work, deep work at all. In fact, probably very little work either anyway, because the sphenoid is very easy to disrupt, and that's for osteopaths and chiropractors and craniosacral therapists to work with. But anywhere up on the skull that you feel tension, your hands should come to areas right away and be able to sense tension and start working on those areas and just try to stretch them and free them out here. My clients are often very, very surprised to find the tension that's lurking in their scalp and in their skull. Forehead, again, work here is very, very good. You can just take nice soft fingers and stretch this. But don't be afraid to work a little more deeply. The knuckles are a great tool here. The main thing you're going to use, you're not going to use the pointed part of your knuckle. You're going to use the nice, flat, fleshy part. And you can anchor with one side and just visualize that you've got skin that's way too tight here and fascia, and that you're just stretching it. Work slowly. Feel for tension. Stop when you need to. This is very, very good work. Do try this. People are surprised at how good a knuckle can feel on the forehead. The other area fascially and on the scalp that I like to work on is the mastoid process. So many connections and so much tension can be held right here. The sternocleidomastoid muscles connect here. All these muscles that tilt the head back, that tilt it from one side to another. So I very often try to pretend that this mastoid process, which is right here, that I'm actually lifting the skull right off the cervical column here. And this is very important because if you just visualize an axis coming right through the neck here, that people should be able to tilt their head right from that axis. But you look at a lot of people with computers, and they're doing everything from C7 and T1, and this is all frozen up here. So if you can get this head moving like this, it's excellent, excellent work, and can really dissipate a lot of that stress in the lower cervicals. So all I need to do here is just get on the anterior part of sternocleidomastoid, soften it up a little bit, and then start working with flexing the head. Remember, I'm flexing the occiput on the atlas here. I'm starting this to move this way. I'm not trying to move the rest of the cervical vertebrae. And I can even get down below the mastoid process with my knuckle. I'll try to keep my body out of the way. And just visualize that I'm lifting this skull right off the spinal column. You can turn it over more and maybe see a little bit here. So on here, I'd be working in this direction and nodding the head. So many people are pulled together and very, very short here, so all you're trying to do is lengthen this. Try it on a friend or one of your clients, one of your regular clients. Try to spend 45 minutes on the front of the neck, the back of the neck, and the head. And you'll be surprised how fun it is, and your clients will love that as well. The only other thing I want to add to the neck is that you need something to tie all this great work you've been doing all the way up through the head. And so right behind the occiput, things do get jammed just about like here at the mastoid process. And all I do is basically what I call an occipital release. I have my hands nice and soft. I don't have them too sharp, pointing straight up. And I apply a very little bit of traction to the occiput
to relax the suboccipital muscles.
The suboccipital muscles. Learning how to work through the superficial muscles to work on these small, deep muscles is crucial for creating balance between the cervicals and the skull. When I say a little bit of traction, I'm talking about 1 to 2 ounces is all. People that start pulling too hard are going to have those stretch receptors in the muscles pull back.
Just wait for the gravity of the head and neck to let the suboccipital area just soften and sink into my fingers.
Sometimes it may take a minute or two. You can't really see too much what I'm doing here, but I just have my hands cradling this occiput right below it, and I just let that sink. The big thing on this is just to be patient and try not to make anything happen. Just keep your fingers soft and curved and wait for that tissue to soften. This is very important when you've done a lot of neck work, because sometimes you free up all these vertebrae, and right at the very top at C1 or the atlas and the occiput, you haven't done your homework, and all that energy clogs up there, and that's when people can sometimes get headaches. So spend enough time, spend a minute, sometimes 2 minutes.
Just get into a very quiet and centered place in yourself.
And you just let the people come back into their reality and get balanced so that they can walk out and feel integrated.
This brings to a close the second section of Deep Tissue Massage, a video guide to techniques, the strategies section. I hope this has been a worthwhile learning experience for you, and let me please reiterate what I've said before, for you to adapt this work to become your own. Experiment, broaden this work, and that's what makes our work so much more fun and makes us much more effective body workers. For those of you remaining, we will move on to the next section, which is the injuries and troubleshooting section.